We've got a really interesting episode today. We are going to talk about constitutional prescribing in homeopathy. We're just going to give you an insight into what we actually mean by this and when we would be looking at it. And of course, whether you're going to stay with the same constitution all of your life. All of these questions will be answered in this episode. Hello, welcome. Thank you so much for joining us today. And I'm so pleased to be able to welcome back Madhavi Naik. Madhavi, it's lovely to see you. How are you today?
Thank you, Mary. Thank you, and nice to see you again too for the second time. I'm doing good, thanks.
Good, good, good. Today we're going to talk about constitutional prescribing. So this is really exciting because we love to talk about this, don't we? And we don't really talk about it enough, do we?
Yeah, that's right. Like we hear about constitutional prescribing quite frequently. It's a quite often used term, and it is also like often misunderstood term. So when we read the organon of medicine, we see that Dr. Hahnemann doesn't say constitutional prescribing or constitutional medicine or the remedy the way we are like talking about it in the present day. So what he meant is individualization and the totality of the symptoms.
So, would it be right in saying that actually what he wrote about in the Organon actually was all constitutional prescribing? So, only because we've got all these other methods of prescribing now that actually we needed a term for that original way that homeopathy was used?
Yes, that's right. Now, what is constitutional prescribing in terms of definition would be that it includes your mental generals, your physical generals, and then your physical particulars. So
So
mental
let's just
generals,
let me just stop you there. You're just about to explain it. Let's explain exactly what we mean by those terms because they are very homeopathic terms and they're not terms used by the general public. So let's just put those in simple words. What do we mean by each of those?
yes. So when we say like mental generals, they refer to the emotional state and the mental state of the client. So even in the mental generals, there is a hierarchy of symptoms. For example, symptoms which are related to the emotions are given the highest ranking, then the symptoms related to the intellect, and then the symptoms related to the memory.
Okay,
So,
so let me just interrupt you again. Sorry, because we just want to make sure because quite often when we mention the word mentals, people think, oh, what do they mean by that? I'm not mental. So what you're saying is mental, the word mental means that we are covering emotions and emotional symptoms, memory, and how our mind is working and what it's remembering. And what was the other one?
the intellect.
The intellect, how intelligent we are, how we're processing data.
Yes.
Perfect. Thank you. Thank you.
Yeah. So this has its basis in Kantian homeopathy. So he kind of gives a lot of emphasis to the mental generals or the emotional symptoms. Um, for him, it was like important that that his definition of disease was something of an internal disturbance, something which disturbs first the mind and then it kind of travels outwards. So this is kind of a basis for Kantian homeopathy, for classical homeopathy, or the constitutional prescribing. So the next layer is in the hierarchy of importance is the physical generals. Now, physical generals are the patterns of the person as a whole. For example, how he or she reacts to the environment. So, in common terms, we say, is the patient hot or chilly? right? It
Okay.
also refers to their energy patterns, high energy, low energy, also refers to their sleep, dreams, appetite. Commonly, we ask them, like, what are your desires or cravings, or what you don't like to eat, your aversions. In cases of women, it refers also to their menstrual history, their menstrual cycles, and also the sexual history, sexual preferences of the person. These are all covered in the physical generals.
Okay. So is that what we sometimes call modalities as well? Is that
Yes,
the same?
modalities is something which will either aggravate or ameliorate. Those are
Okay.
the modalities.
Okay.
So,
So we're taking a specific um, thing or environment or um, circumstance which would make the symptom better or worse. So that also might be time of day where you're better or worse as well. Yeah.
yes,
Okay. So that's physical generals and mental generals.
right. And the last category, or the last thing in importance, are your physical particulars. So, commonly known as your chief complaint or your main complaint.
Okay.
And
So what you're actually saying is that's way down the list.
yes,
Okay. Really, really interesting. So what we're actually looking at is why are you you? Who are you? What is you? And then how you express your symptoms is the information that we take into consideration third.
yes.
Okay. Okay.
So, when a client comes to you, they always come to you with their main complaint or
Yeah.
their chief complaint. And then, as a homeopath, the way we do our case taking is that we ask them anything else. So we are going like deeper than the patient tells you about their physical generals, what is affecting them. Then it is the mental generals. So what is like the most important is like uncovered at the last.
Yeah.
But what is the least in the hierarchy for the constitutional prescribing is uncovered the first.
Okay. And so, it's not surprising, is it, that clients come to us and say, yeah, I've been having migraines, that, because whenever they go to normal health practice, is their local health practitioner, then they are always going for these symptoms, and that is what they're saying. Okay, we'll have a look at those symptoms and see how we can make you stop feeling that or stop having those symptoms. But so this means that homeopathy is totally different, doesn't it?
Yes. Uh, like you said in the earlier segment, that there are like many ways of like prescribing, and constitutional prescribing is one of the way of how homeopathy kind of views a person. Like in homeopathy, there is individualization, as well as we take into consideration the totality of symptoms. And the most interesting thing about this is we prescribe for the state and not for the personality type, right? For example, when a patient comes to us or the client comes to us, and when we do the case taking, the prescription or the remedy is based on the current state, the current totality of the symptom, and not how he or she was in his childhood or even 5 or 10 years ago. So that is kind of an important principle in homeopathy.
It's really interesting, isn't it? Because people are often blown away by the questions that we ask in order to get this information. And yet, if we started by saying, now we're going to actually be asking you this, and this, people would think, well, that's not relevant. But when they actually go through the process, they suddenly see how relevant it is, don't they?
Yes, that's correct. And when a case comes to us, we always look for patterns. So we don't like straight away go into chronic case taking. We look at various layers. we first see what is the acute layer the person is presenting with. Then we go on to the chronic layer, or the usual patterns, the general patterns the person is like expressing frequently throughout his or her lifetime. And then we go into the deeper constitutional patterns. I can like illustrate this with an example. Uh, yes. So a client of mine, she's in her mid 50s or early 50s, and she came to me with a variety of complaints. So if we look at it, we would say that, okay, this is not covering like one remedy, right? So what she came with, she came up with was, she came with general soreness, body ache soreness, and she said that she's very active. She does like running, participating in marathons and things like that, playing sports. And then she also said, during the end of winter, start of spring season, she gets this cough. She has the seasonal allergies. And when she coughs, it's kind of a hacking cough and a productive cough. And then she also said that she has insomnia. Like she has difficulty, like not only falling asleep, but staying asleep, that she wakes up in the middle of night at around 3 o'clock. And after that, it's like difficult for her to go back to sleep. And even like the slightest disturbance in the house or outside the house will kind of wake her up. And then when I probed into her history, I came to find out that she is also a caregiver for her parents who are into their mid 80s to late 80s. And they also are showing signs of early Alzheimer's.
Mm-hmm.
So from this, like we can see that she's into her caregiving role. She is kind of overwhelmed because she's the only caregiver for her patient, for her parents, and she has been doing this for a long period of time. So, how would I kind of approach this case? So, the first thing first would be an acute layer. So, when she complained of soreness in her body following intense exercise, intense physical activity, it was arnica. So, arnica provided her relief, right? And then during her, she was a long term client of mine. So, as her spring allergies started, um, it was again this cough with expectoration and hacking kind of cough with pain in the chest. So I prescribed her Briania, right? That took care of the hacking kind of a pain, or the chest hacking kind of cough with pain in the chest. And then was her insomnia. So insomnia is, again, if you remember, it was physical general. It is related to her as a person, asleep. Whereas the other two were the physical generals.
Okay.
So this kind of required more of a constitutional prescribing. And if you see her history, she is obviously like taking care of her parents. She's kind of an overwhelmed caregiver. I prescribed her sepia. And then when I kind of zoomed out, uh, I could see her whole picture, right? If you go into the textbook, it is like sepia person. They like physical activity. They like being in open air.
Yeah.
They are like overwhelmed by caregiving. And they also have like this seasonal allergies like hay, fevers, and things like that. But for her, I did not typify her as a person. Like, okay, this is a sepia personality, or this is a nux vomica type of person. It is how we treat the layers. So when the physical particulars came, such as the body soreness following physical activity or seasonal allergies, that time I prescribed her for acute layers, or for her tendencies, a chronic prescription of Briania. But for her insomnia, I prescribed her sepia, which was like a constitutional prescribing.
Okay, it's really interesting, isn't it? And this is a good point for us to mention that acute illness overrides chronic illness. So if you go to a homeopath or any health practitioner, and you're being treated or being, assessed for a long-term health issue. If you then have a short-term health issue, an acute issue, that energy is much higher and needs to be dealt with before you go back to the long term. So we would quite often see this as we're looking after clients over a number of months or years, wouldn't we? That we're slowly working through the layers, and then something acute happens, so that takes priority, and then we go back to the layers. But it's very interesting listening to you, because what you're actually saying is, whilst you're doing the acute, you didn't see that constitutional picture, and it's not until you take everything into account that a totally different remedy comes up. It's very
Yes.
interesting.
Yes, that's right.
Okay, so now you also mentioned, sorry, I'm just trying to think back to what I was thinking as you were explaining. We talked about a sepia picture or a nux vomica picture, and we know these as constitutional kind of personalities. Can you explain a little bit more about why we see these as a certain picture?
Right. So, what has happened, like I said in the first segment, that we have heard constitutional prescribing, constitutional types very frequently, right, in our classes, in our webinars, lectures, or conferences, and things like that. But the way to prescribe is based on like individualization and the totality of symptoms. There is like no picture, like this is a sepia type, this is a nux vomica personality. You are kind of prescribing for the state, the presenting state of a person, how the state is, how the person is presenting. Because there's no constitutional remedy for a lifetime.
No.
The remedy keeps on changing. So if the person is, say, supposing sepia today, she or he might require a totally different remedy following, like in a few years. That's because as people, we are always evolving, right? And with us, our states, internal states, also keep on evolving. So when we read about those pictures in our textbooks, like a sepia person looks like this. So that description is for that particular person in that particular time frame.
Yeah.
And it is not necessary that the sepia person will be a lifelong sepia. A nux vomica person will be lifelong nux vomica.
That's very interesting and very important for us to talk about this, because quite often a number of remedies are very similar, aren't they? And somebody might alternate between two or three different remedies because they are so close and they're very related. And of course, that might be Staphysagria carcinosa Muir type of, and depending on what's happening in your life just now, you might be brought out in various different things. And I say quite often, I've got a very tubercular sort of feeling. But actually, there's only ever been once in my life that I've taken tuberculinum as a remedy, because I haven't needed it, even though those traits come out quite often. It just has to be at the right time that remedy is right for you. And people are often asking, aren't they? Well, this is my constitutional remedy. And we know that we see with everything that happens in the world that it doesn't mean to say that that's the right remedy just now for you, because you've gone off in another state. And I think sepia is quite often that as well, isn't it? Because quite often we need sepia after childbirth or going through menopause or going through a hormonal state, because of course we move into a different state at that time. And I often think also of calc carb children quite often develop into sulfur adults, don't they? And they're just going to evolve, and we're all different, and we need to take into effect how we are reacting to whatever's happening right now.
Yes, that's correct. And you brought up an important point, right, of the person's state evolving, the remedies evolving. And I can tell you another case from my example,
Yeah.
like how a acute case can be also a chronic remedy, or what we think could be like a chronic remedy or a constitutional remedy could be used as a acute. For example, a child presented with discharge from his ears, both ears.
Okay.
And the mother said, like, he was like a 4-year-old child. So the mother gave the history that it was like yellow colored discharge, and it kind of crusted. And the mother was in the car, and the child was in the back seat of the car, in the car seat. So whilst the mother is giving the history, the child is like wanting to come in the front, right? He's like not in pain at that moment. And I observed that, and I asked, like, how is he? Like, is he in pain? Like, so much discharge is coming from both the ears. They went to a pediatrician. The ear was actually red on the inside, so it's inflamed, right? She said, no, not even once he cried. And he has like a friendly demeanor. He's like talking with me. He's not like shying away, hiding away. And then other thing was that this person is like not only like interacting with me, he was interacting with his mother, and even with the pediatrician over there. He allowed his examination. And I asked about the general demeanor. She said he's like very mild and gentle. So when we see about this mild, gentle, we think about a remedy, Pulsatilla, right? We say that, okay, this is like a constitutional remedy, but would it help in acute cases? Yes, when
Yeah.
it matches the totality of the symptoms. So if you see Pulsatilla, they have this thing, tendency for like your ear, nose, throat region. So ears, there is the discharge, which is yellow, bland discharge, does not excoriate, and there is crusting. And the patients are worse, like during the nighttime. She said he tugs at his ears in the nighttime, like gentle tugging, but he is not complaining, right? So gentle, like painlessness of the complaints. And the patient wasn't like crying and howling like a chamomilla would do, right? Not taking comfort, but was like indeed very clingy to the mother, like wanting to be near her, very open. So the pulsatilla like covered the whole state of the person.
Really interesting, and such an important point to notice that I mean, let's just talk about the fact that these remedies have such a huge potential, don't they? They have so many different symptoms associated with them, and we call them polycrests, which means that we use them again and again and again and again and again for lots of different areas, which means they have a huge picture. And so quite often, yeah, we see this going through. You mentioned before the cycles that people go through.
Yeah, those are kind of layers,
Okay.
like the acute layer, the chronic layer, and then the constitutional layer, right? So when we are like kind of doing constitutional prescribing, some of the common mistakes could be like avoiding or ignoring these layers, like ignoring the acute layers of a person, ignoring the chronic middle layer before jumping onto the constitutional layers, and also like labeling patients, labeling clients like personalities. So even though we ask about the emotional state of a person, the mental symptoms, we are not doing like a personality tests on persons. We are not typifying like you are a Naxwamika personality, you are a Sepia personality, you are a Kelkar personality. So prescribing based only on personality is like one of the drawbacks, you could say, of using constitutional prescribing. And as you correctly mentioned, that all these remedies, whether constitutional or whether acute, they have like they are polycrest. Like these constitutional remedies can be used in acute situations as well.
It just gets more and more complex, doesn't it? The more we talk about it, because the thought going through my mind then was, of course, when we are looking for a remedy, we are certainly considering a constitutional element of that, but we're also considering a miasmatic element of it. And of course, you've mentioned the acute and the physical symptoms as well. And there are lots of other prescribing methods that homeopaths will be considering. And so it's quite a complex job, actually, isn't it? Which remedy is it that we actually start with? Because in reality, it could be different for each person we speak to, couldn't it?
Yes. And it all depends on the approach, like how you approach the case, right? So in my practice, how I would approach a case would be like a detailed case taking
Mm-hmm.
and then the case analysis. So when I do case analysis, it is like based on the classical homeopathy using the Kantian method, which is again the hierarchy of symptoms into mental generals, physical generals, and then particulars. And then we have something called as a repertorization. So we have a wonderful tool, which is our repertories, which is like the symptom, the remedies are listed against the symptoms. So when we do repertorization, we come with a list of remedies, right, in the columns. And we often see that the first remedy, which comes in the list, is not always the prescribed one or the indicated remedy, right?
Yeah.
Your indicated remedy could be somewhere third, fourth, fifth on the column.
Yeah.
So uh, using a repertory as a tool, like as a compass, just to kind of narrow down is also an important approach. And then the other approach we use is like using extensively materia medicas, like going back to our materia medica and seeing what are the mental generals of the patient and like matching the remedy to the present state, to the totality of symptoms, and not to the personality of the client. So that's how we kind of approach the case, and that's how we come up with a remedy. And this whole process is basically the essence of constitutional prescribing.
Let's just make sure that we're everybody's understanding what we mean with the repertory, because if you haven't come across this word before, it is a book that has got in it not only the symptoms, but also the way that you might feel or express those symptoms. So actually, it has in it a whole load of things that people have said about their symptoms. So, for instance, about the headache, they might say it's a throbbing headache, or it's a pulsating headache, or it's a stabbing headache, or it's a hammering headache, or it's a headache that feels like there's a belt around the forehead, or feels like a cap is too small. And all of these things, these ways of seeing a headache, is written in this book. So the questions that we are asking is seeing if you are going to say any of those statements that is already written in these books. And some people think, oh my goodness, you're going to think I'm mad if I say this. And I can go on, try me. No, it's got it right here in the book. Somebody else has said that, experienced that exactly the same way. And they're usually amazed, aren't they, that actually we've got books that say how people feel a symptom.
Yes.
It's just such a lovely, that's what we love about homeopathy, isn't it? And then just going back, I think, so most people will have heard of a Materia Medica, which is actually listing all of the things that this remedy has helped with. So if we're thinking, as in your case earlier, oh, this might be a pulsatilla, let's have a look, and we have a look through the pulsatilla, there might then lead to other questions that we can ask the client as well, doesn't it? So it might sort of trigger our, well, do you ever feel such and such, or tell me about your nose, and we're looking to see if there are other reasons why we might choose that remedy. So it's fascinating, isn't it? So our questions are based on what we know, those key points about each remedy, but also about how you are explaining it is also really, really important to us. Can you say a few words about observations, about what other people might be observing? Obviously, you had a case with a mum and child, and it's useful getting other people's observations and of course your observations, what you could see from having that person in the video in the background.
Yes. Observations are like very important in homeopathy and for multiple reasons. In the first case, in the case of the child, for example, the observation was mostly of the uh, mental generals, right? How the child was like uh, behaving emotionally, his personality,
Yeah.
so-called, like how he was and in that stage, and how he is otherwise. And other kind of observations that are important in homeopathy are the maintaining causes or the obstacles to cure,
Okay.
right? So this is like particularly important when we are doing constitutional prescribing, that we should not ignore the acute layers, the maintaining causes, the obstacles to cure, and sometimes even like the terms that our clients use. For example, there are many terms like newer terms which were not there during earlier times. For example, adrenal fatigue.
Mm-hmm.
It wasn't there previously. Um, Food noise. This is like not there previously, right? And this is like something which the clients teach us. I can give you example about food noise. So sometimes if you hear the term food noise, you might think, okay, this might be a symptom which the patient has
Mm-hmm.
something to do with their esophagus or their stomach when they eat their food, right?
Uh-huh.
And we might open up our repertory and go under esophagus or throat food noise, something like that, or in the stomach noises, sounds, things like that. But if you if you are in current with the state of how like the things are working in the world right now, the word food noise refers to things in the mind actually. Like when a person continuously thinks about food. Okay, I just had my breakfast. What am I going to have for lunch? That means the person is pre-planning, right? So
Yeah.
that's like a food noise. And there are now newer pills in conventional medicines which kind of lower that food noise, right? The GLP-1 drugs, etc. So
Okay.
the clients or the patients are referring to food noise in that reference. So when somebody asks, are there any homeopathic remedies for like food noise? That would mean like something to decrease your food cravings,
Okay.
or your appetite. So regarding this maintaining causes or obstacles to cure, I can tell you a thing like which happened with me when I was a medical student. I was in my second year, and I had this pain and redness in my eye, and it was hurting me bad. So I went to a homeopathic lecturer, okay, thinking that, okay, I'm now studying homeopathic medicine. I will take a homeopathic remedy for the pain in my eye and the redness.
Okay.
So the lecturer kind of prescribed me a medication, so a remedy. She gave me Stephysagria 200C. And I took the remedy, and then 2 days passed and nothing happened with Stephysagria 200C. So I was like still in pain and the redness was still there. So what I did, I took like a mirror, those are magnifying mirrors, like you can take it. And I just lifted my lid and I rotated my eyeball. And then I could see like a huge eyelash came up on my white part of the eye, the cornea
Yeah.
part of the eye. So that was the maintaining cause, which was causing irritation. So Steffi Segre 200C was given with a good intention. She might have thought that, okay, this could be a start of a sty, right? And we know that Staph Segre is indicated in eye complaints, particularly like things like styes, uh, infections of the glands, and things like that. But this was like a maintaining cause. The eyelash was the maintaining cause. And that's what like Henneman tells in Organon of Medicine, that we should be removing the maintaining causes or obstacles to cure. He talks about suturing of the wounds, bringing the edges of the wounds together, applying things which kind of stop bleeding, right? Also talks about use of setting bone setters to
Okay.
like hold things in place so
Yeah.
that along with the remedy, like these things also kind of help.
So
So
homeopathy is not instead of these things. Homeopathy works with these things. You have to get these things sorted.
yes, that's kind of important in constitutional prescribing, that we should not ignore the maintaining causes or obstacles to cure.
Exactly. And he also mentions, doesn't he, things like mold and the environment not being right. And because, of course, smoke in the house, because some houses didn't have chimneys at that time. So, and also eating properly, he mentioned, didn't
Yes,
he? Where you can't
yes,
expect your body to function properly if it hasn't got all the minerals and vitamins that it needs. So, so if there is something, and your eyelash explained it beautifully, is something that is going to continue making those symptoms unless it is removed. It makes
yeah,
complete sense. That was a
yes.
fantastic example. Thank you.
You're welcome.
Madhavi, I think we've opened up a lot more questions with this. So thank you so much for coming on and talking with me about this, because bringing your case examples is a really good way to help people understand. And just having this conversation is so important so that people can understand a little bit more about the terms and things that we use as we are talking to you about homeopathy. Thank you for your time.
Thank you, Mary. Thank you for having me on the podcast. I enjoyed talking with you.
Well, I hope you enjoyed that. It really was a bit of an eye-opener, wasn't it? I'm not sure. I think it brought up more questions than it actually answered, because there are so many terms that we use. And unfortunately, as homeopaths, we quite often forget that we're using these terms and that you might not be au fait with them. So I would be really interested in hearing about what you thought about this and about any of those phrases or words that you're still unsure about, because it's our job to make this as clear as we possibly can for you. If you enjoyed this episode, then please check out this one.